The left ventricle. Left ventricle is the thickest chamber of the heart. It is oval in shape as the interventricular septum is concave towards the left side. Left ventricle contains only two papillary muscles, the anterior and posterior. These are stronger than the papillary muscles of the right ventricle. The entry channel into left ventricle is the bicuspid valve. The cusps are anterior and posterior. Exit channel is the aortic semilunar valve. The exit channel of the left ventricle is the aortic semilunar valve. There are three cusps in the valve, one anterior and two posterior, all being stronger than those of the pulmonary valve of the right ventricle. The interventricular septum. As the name indicates, the interventricular septum separates the cavity of triangular right ventricle from the oval left ventricle. It is muscular in most of the part, except in the uppermost part where it is membranous. Part of the membranous interventricular septum separates left ventricle from the right ventricle, from the right atrium, and partly separates the right ventricle and left ventricle. The septum is supplied by anterior and posterior interventricular branches of the left and right coronary arteries respectively. In the upper part is seen the interatrial septum, which separates the right atrium, which is placed anteriorly, from the left atrium, which is placed posteriorly.